Good morning, everyone. Doctors are very good at starting medicines, but they are extremely bad at stopping them. Today, nearly 40% of the older adults take five or more medications. At the same time, many of them aren't harmed by their disease, but by the medication meant to treat it by overdosing. This silent problem is called as polypharmacy, and it's one of the most overlooked causes of the hospitalizations in elderly patients. So, the core issue isn't the lack of medical knowledge, the issue is the cognitive overload. A doctor typically has 10 to 15 minutes per patient. An elderly patient may be on 10 to 15 different drugs. To review that safely, the doctor must manually check many criteria, rules, and they need to check anti-clonic burden, kidney function, frailty, the life expectancy of the specific patient. All of this information exists, but it's all locked inside dense PDFs and guidelines. Doing this manually during a live consultations takes too much of time. So existing digital tools don't actually solve this. They don't understand whether a patient are not specified to the patient, whether the benefits of the drug will even occur in the patient's remaining lifespan. This leads to alert fatigues where doctors learn to improve warnings, even important ones. So the real problem is not missing data. The problem is making safely computable and usable in real time. To solve this, we have built a deprescribing clinical decision support system, a copilot for geriatric medication safety. The key idea we use is it's a dual engine architecture. First, we use a deterministic safety engine, which we cross-reference with all the available data, like the criteria which are and the known list of medications which are harmful for the adults, and check their anticoagulation burden, and uh, then pass on to the another layer where it is cross-referenced with the patient-specific needs, and then based on that we generate medicines green, yellow, and red. Based on that, afterwards we'll so here I'll show you the demo. Here, when I click on upload prescription, we can directly upload the prescription, so it will be helpful. We no need to manually enter all the data, and click on open. The AI will analyze the picture and extract all the medicines which is needed by them. By the time AI is extracting all the features, it has already extracted. These are the features, medicines which it has extracted. So it can also be edited and done. So if I click on confirm and add all the medicines will be added here. These are the medicines. So here quickly we'll just fill the patient information, and frailty means how weak are they, and what are the comorbidities means the multiple diseases in a specific patient. I'm just taking an hypothetical situation. These are the lab values, which include the uh, kidney values. So it will be specifically for the patient. I'm just taking one example values. These are them. And then if I click on analyze patient with AI, this clinically references and calculates all the medicines and checks all the rules, and then calculates everything, and then gives based on this gives medicines categorized into three categories: red, green, and yellow. Red means it should be viewed and stopped. These medicines are harmful for the patients. These are the medicines which is generated. Like three medicines have been classified as high priority. Seven medicines are classified as in clinical assessment. Because these are yellow categories, so this can so the doctor can take a look at this and then use this. These are the calculated kidney per EGFR value, so which would be helpful for us to in the calculation of the medicines which are harmful. These are the three medicines which are harmful because we have also given the reason why it is harmful, because there's a criteria, BS criteria, which is a national level criteria, where ibuprofen is proven to be harmful for older adults. And along with this, these in the yellow section, we have four to five medicines where this medicines is treated because these four medicines are used to treat the same issue. So it is already repeated. So this issue will be used to resolve this. These are the medicines which are safe to continue. So this is if we click on AI taper plan, it clearly generates a full taper plan of how this medicine should be stopped week by week. And if I click on monitoring, this again, how should we monitor? What are the symptoms you should be monitored? It gives a detailed monitoring plan. By making this deprescribing practical, we can reduce adverse drug events, prevent hospitalization, and help older adults maintain independence, and also reduce the time of the doctors significantly.